Hi students, so this video is going to review Unit 3, which is weeks 5 and 6 discussion post. Let me move this over just a little bit here. All right, so this post has 3 parts. So the first part that you are going to do is the 4 M's PowerPoint lecture. So basically all you have to do is fill out this template regarding the 4 M's. And with this, you can utilize previous clinical experience, you can utilize current clinical experience, you can utilize work experience. You can also utilize simulation lab if you've done that before as well. So really any type of older adult client experience you can utilize for this presentation. So let's first look at that. So this is what the 4 M's presentation is going to look like. It is a PowerPoint template. Please leave it as a PowerPoint template. Please submit it as a PowerPoint template. Just utilize this. All you have to do is edit it and then save it and upload it to the discussion forum. So this is what you're filling out for part 1. Again, the 4 M's, nursing care for older adults. You want to make sure you put your name and the name of student, remove name of student, put your name. And then we will go through each slide here. So again, this is going to be attached to the discussion forum at the bottom. I will show you where everything is attached once we get through all these documents. So let's go to the next slide. So the 4 M's, what matters most, or what matters. This is the first M. So matters is our first M. So basically you're going to think of a patient in a situation and you're going to, answer these 3 questions. So 1, what mattered most to the patient? You know, maybe they were in the dying process and what mattered most to them was comfort or maybe peace and quiet or having family around. Then you're going to record how you documented it or how the nurse documented it, because I know as students we're not always documenting. And then how can the student align the care plan with what matters most? So how can you alter the care plan for the older adult client depending on what's going on, depending on what matters, to fit in what matters most to them. Slide 3 is medication. So how does the nursing team implement the medication of 4 M's? So again, thinking back to a patient, why are we as nurses reviewing high-risk medications, and why are we documenting them appropriately? And then why should the nurse avoid high-risk medications and document or communicate changes as appropriate or to the provider? So you just are going to answer those questions there. Mentation, how do we implement this as the nursing team? So again, we're thinking back to a patient. If they hopefully did have some delirium. If they did not, then you can put in A for that section. But was delirium screened for at least every 12 hours, and did the nurse document it? As a student, how are you going to ensure adequate oral hydration? How often, as the student, would you or did you with this client orient them to time, place, and situation? How did you as a student ensure the client had all their personal sensory adaptive equipment? So things like their hearing aids, their glasses, contacts, dentures, all of that type of thing. How did you make sure they had all of that equipment? Even maybe their call light as well. And then the last one, what are some support for patients related to non-pharmacological sleep? So what are some things that we can do that is not melatonin to help our patients sleep? Slide 5, we're looking at mobility. So how do we implement the 4 M's of mobility? Again, thinking back to a client, how can the nurse screen for mobility and document it? So maybe we've got a patient that's a fall risk. Maybe we're getting physical therapy involved, or we're walking the patient multiple times a day to determine if their mobility has changed. Documenting their fall score. How can a nurse ensure early, frequent, and safe mobility? So answering those 2 questions. Moving on to slide 6. This is just a reflection. So how can the 4Ms process help with legal aspect of caring for an older adult? How can the 4Ms process help with providing ethical care for an older adult? How can the 4Ms process assist in providing holistic care for the older adult? So all you're going to do is you're just going to reflect on this process, reflect on what you've seen through each of the 4Ms with your patients that you've had in your clinical experience, and how does the 4Ms help us legally, ethically, and holistically? And then last but not least on this slide is the references. So using proper APA citation, placing in alphabetical order, and then of course reviewing the 7th edition APA book, okay? If you guys have any questions on this PowerPoint, please reach out to me. There is also another lecture that goes through the 4Ms a little bit more in depth as well throughout the lesson plans. So I'm going to get out of this document. And then one more document that you'll see that is attached is a notes sheet. So, maybe you're going to clinical and you need to utilize this to kind of get an idea of how to do your PowerPoint. So, this is just something you can use to jot down ideas. What are we looking for? What matters most? What medication are we given that's high risk? All of those types of things. So this is just more of a observation sheet to take with you to clinical or simulation if needed. So that is part 1. So all you have to do is just fill out that PowerPoint. You don't have to voice over or anything. All you have to do is fill out the PowerPoint and submit it. One thing to remember, you do have to have 2 research articles. References must be within the last 5 years. Moving on to part 2 and 3, they're going to talk about nutrition. So part 2 is answering these 3 questions. What are factors that affect nutrition as a client ages? What are some nursing interventions to alleviate any issues or factors that develop as with our nutrition as our clients are aging? And then what are some education points when it comes to nutrition? Part 3 is to complete the Engage Fundamentals 2.0 Nutrition podcast. And this is both the nutrition for cardiovascular health and nutritional needs. And I'm going to pull up that. So you're going to go into your ATI Engage Fundamentals, and you're going to go into the nutrition one. So when you pull up this nutrition modules, all you have to do is click on the podcast button, and then it'll pull up 2 podcasts. So nutrition for cardiovascular health and then nutritional needs are the 2 that you need to listen to. They're a little bit over 10 minutes put together. You can also read along by looking at the transcript as well. So complete those 2 podcasts. All you have to do is listen to them. After you do that, then you're going to go to the attached document, which is the self-reflection activity. And it's nutrition, and all you have to do is answer this question. So reflect on the nurse's role in ensuring clients' understanding and adhere to their nutritional needs after discharge. That is the only thing that you have to answer, only reflection. And then once you are done with that, you are done with the discussion post. So a few things to remember. 1, make sure that you attach the PowerPoint and the reflection worksheet to this discussion post before you submit. Part 2 you can fill out just by answering the questions in the forum. And then one more thing here is these are going to be all of your attachments. So you've got your observation sheet, you've got your template, the PowerPoint, and then right here is that ATI nutrition reflection worksheet. Also attached is the rubric. I will go through that in another video just so you guys, because this one's getting kind of long. Last thing to note is the peer post. So you must have 1 peer post, must have 2 research articles, and you are going to expand upon your peers' post, whether that be expand upon their 4Ms PowerPoint, expand upon their 3 nutrition questions, or upon their reflection. Okay. If you have any questions, please send me an email or meet me in my office hours.